Dr. Chris Waterer is here with us today for Medical Matters.
He is a cardiologist here in town and wears lots of hats, including the Mississippi Healthcare Alliance. Thank you so much for joining us.
Thank you for having us.
This organization is relatively new, and what it has done is coordinated efforts to lower our mortality.
Correct.
As well as our morbidity. Number one for heart problems, and now including stroke.
Including strokes. This was a collaboration of several hospitals in the area and actually across the state now to incorporate standardization of first for acute MIs. And what we've been able to do is shorten time to hospitals, educating patients to call 911 as opposed to getting in the car and driving for a period of time. And that has improved the 911 by 30%. If you look at that over the last 5 years or so, is when we first started this organization as a group of volunteers, got together in the healthcare field, and it ranges from physicians to nurses to EMTs to first responders out in the town. And it's really been a great effort to watch the volunteer groups get involved with this.
Now, we've talked about heart, and February is all about, the month of February is all about the heart, but stroke as well. It's amazing to me how many people have the symptoms and instead of dialing 911 think they can get themselves to the hospital, and it makes all the difference in the world in the outcome.
Exactly. The sooner you can get to a medical professional, and even here in Jackson we have facilities here that you don't have in some of the rural areas, but the rural areas can still initiate treatment that you can't get in your car en route. And once it's even started and others are alerted for an MI, for instance, we'll have the cath lab team waiting in the hospital for the patient to get there so we can go straight in and try to open an artery up that stopped up. The same type thing is going to go on with strokes as far as the way you can alleviate stopped up arteries there, which limits the amount of damage that's done, and you end up with a patient that recovers better with much less damage.
And sometimes can result in the difference between having paralysis and not having paralysis.
Or life and death.
Exactly.
I guess the thing about calling 911 is you waste treatment time.
Yes.
Now you may not, you're not in the car headed that way, but that's treatment time lost.
Exactly.
And that's what people don't understand.
Right. I mean, you get an IV started by an EMT, they hook you to a monitor. There are things en route that if you deteriorate it that they can do that you can't get done with a family member in a car. And so that's where you're delaying, what you can get done.
Now, the Alliance, you've come together, but this is also about education. This 911 campaign is a big campaign statewide, again, emphasizing how important it is for people to get that help as quickly as possible. And I guess one of the things, and we've talked about this a little bit, one of the things that we self-diagnose too much. And that's one of the problems that you're trying to combat. Right.
I think the education with dialing 911, but it's also education about signs and symptoms of what heart disease and a stroke are, how to respond, how you could initiate treatment on your own, what the risk factors are to try to prevent that. And we have symposiums and across the state in the Northeast, up in Tupelo, Southeast, and in Jackson area, all across the state throughout the year.
And I've watched those programs in action, and it really is impressive how the ambulances do, and the EMTs take care of those patients. They initiate all of that treatment. It's initiated, so though you're not spending time at the hospital putting in IV lines and stuff like that. It really is efficient as it can be, and it does save lives.
And it really is. I mean, the biggest push here that I think we've been is most helpful is involvement in everybody outside the physician realm. I mean, the people, the EMTs and the nurses, the first responders, whether it's a volunteer fire department or whoever is there that can deliver the first aid initially, those guys really make the biggest difference.
And the campaign is called Dial, Don't Drive. They are the experts, we're not.
That's right.
All right, Dr. Chris Waterer, thank you so much for being with us. We appreciate it.
Thank you so much.